so honored to bring on now Dr. William Strudwick, as I said, with United Medical Center. Dr. Strudwick, how are you?
I'm good. I heard you talking about my team, the Washington football team, so I was very excited. They put up a good fight. Um, yeah, I wasn't happy to learn about the political affiliations of our quarterback from that game, but you know, I was very happy with their effort in that game. So.
Well, I always say if we start peeling back the onion, it's a lot of affiliations we're not gonna like, but we kind of see folks for who they are and celebrate that, and then other stuff happens. But
That is true.
which is what we're dealing with right now with this COVID-19. I'm so excited because, as we talked earlier, I know about the family that you've come from. I mean, that you're still in the trenches. I know that they would be very proud of you for actually coming to what I would call the battleground of
Mhm.
COVID-19 in the District of Columbia. You're here in Southeast at the United Medical Center. Tell us what you all are dealing with over there.
So clearly, and I think there's a little echo, but in Ward 7 and 8, we have the greatest death rate of any ward throughout the city. So, like you said, this is the battleground. This is where the focus is, and this is where the focus should be. Um, so yes, we're taking care of a lot of patients here at United Medical Center. Other hospitals throughout the city are taking care of patients that are from Ward 7 and 8. But when you look at it, our wards are the wards that are being affected the greatest of any areas in the city. Um, and in terms of like disparities in care, um, we're the only hospital east of the river. So, I mean, that says it in a nutshell. There's 6 hospitals west of the river. There's 1 hospital east of the river. And we proudly serve this community. But what it means is there's less doctors, there's less pharmacies, there's less primary care. And in addition to that, there's less healthy food options, less gyms, less parks. So all the things that lead to health disparities, whether health care or getting healthy and maintaining your health, there are disparities when you compare where we are to where other areas of the city are.
And on top of that, our business is located in Ward 8. I live in Ward 8, not very far from the hospital. And, there's rarely a night when I'm not hearing either gunshots or ambulances riding through the neighborhood. And I often wonder with what the hospital's dealing with over there. I mean, I'm sure a lot of those patients are having to go to other places. You're not a Trauma One hospital, right?
Correct. Yeah, we're not a trauma center, so
Right,
trauma
right.
does have to go elsewhere, which has always been a question for me. That in the area where we do have a lot of psychological, social trauma and other types of trauma, that we don't have a trauma center here. And when I'm looking at what they're planning for the future, there really are no plans for a trauma center in this area. So that's a question that I have about the plans and whether people really have the desire to address the health disparities in our area.
I'm so glad to hear you actually share what have been the feelings and the fight of so many in the community for the last few years. But let me ask you also, the Vice President-elect Kamala Harris had her COVID-19 vaccine at UMC. How did that come about?
Well, I'll tell you. I can't tell you because I'd have to kill you. It's all a secret. But we were contacted. I personally was contacted and was told that she would have some interest. And when I was contacted, I was told that nobody could know. Like I could only tell a very few people. And they also told me that they had attempted to get her vaccinated elsewhere, but it got out, so it was canceled. So that put me on a track of being very discreet. So I was able to, me and several people at the hospital, and including of course security and Colleen Daniels, our CEO, we were able to work with the Secret Service and work with her advanced team to get her here. And I think she came here for a couple of reasons. I think number one, she recognized that our vaccine program was outstanding and it's been an unqualified success. And then I think she was also had the desire to kind of be an influencer in this community and other communities that look like ours. Not just in the United States, but internationally, because she does have an international reach. So I think, she was a real servant leader in her thought process for coming here. Of course, she felt safe because our program is fantastic. And then also she knew that she could make a difference as an influencer by getting her vaccine here because our community is devastated, but also our community is hesitant in some instances to take advantage of getting the virus.
So, I mean, that brings me to a very real question, and there's some conversation. We've interviewed Dr. Reed Tuckson with the Black Coalition Against COVID, and we know that there are medical staffs across the country that are electing not to take the vaccine. Have you seen that at UMC, and is there any reason that they're giving for not wanting to participate in the vaccine program?
I mean, every reason that you can think of, from I have allergies to they're going to put DNA in my body and it's going to alter my DNA to just everything that you can think of. We've heard. Now, when we first started with our vaccination program, of course we were able to develop it and execute it in at a high level. But still, within the hospital, we had a lot of people who were hesitant to take advantage of it. We started with about 20%, I'd say 20% of our staff that said right off the bat that they wanted to take the vaccine. But we have progressed from there. So with education, with time, we've given 1,200 vaccines so far here at UMC. And they've seen that people have had a great experience, that they haven't had any reactions, and we haven't had any reactions, no allergic reactions at all, or any other type of reactions. So now people are saying, okay, this is safe. We know that it's effective. So more and more people on our staff and in our community are coming to get the vaccine. Like we're doing a bustling business in the vaccine right now. So things have changed. And I can tell you the day after Kamala Harris got her vaccine here, our phones were ringing off the hook. So that she actually did influence our community and our staff to get the vaccine.
That's wonderful. So it worked. So I guess you've already answered the question that whether she'll be coming back for her second vaccine. You can't tell me or else you'll have to kill me.
Yeah, that's not a conversation we can have.
All right. But on another note, and I want to talk about something else positive about UMC that I heard recently, but that you all have, I guess, in partnership with the National Children's Center, but you have one of the most phenomenal children's, I guess, what would you call it?
Emergency.
Yeah, I heard that you have one of the best in the city. You want to talk about that?
Absolutely. So we have within United Medical Center, we do have a full service emergency department through a partnership with Children's Hospital. As I said, it's full service. They have a separate staff. It's a separate environment that's conducive to pediatrics, that makes kids, feel like they're in their own place. The leadership is fantastic, comes from Children's Hospital, and they put a lot of effort into making sure that this partnership serves this community for pediatrics. Now, this community is younger than the other communities in Washington, D.C., so pediatrics is certainly a service that we need. So for them to partner with us and create an emergency department that is so at such a high level is just a fantastic thing that we have here at United Medical Center.
So I guess I'll close now, but I'm just wondering, what is it that you would want, again, particularly people in Ward 8, I mean, how accessible, going back to the vaccine, is it And at what level are you all now in providing vaccines to community members? I know that, and one other question I'd like to add in, because I heard something yesterday I thought was really interesting about the vaccine and smokers. I don't know if you know anything about that, but if you can add that also about how this vaccine may impact smokers, but what folks need to know about the accessibility over at UMC. Can they come and get a vaccine, and how does that work?
Right. So right now we're at for the district, and a lot of our vaccine we have to make sure that we're adhering to the district's mandates. So we've done our staff, we've done community physicians, or we've been open to community physicians and their staff, and now we're open to Ward 7, Ward 8 residents that are 65 and over, and we've been seeing people Ward 7 and Ward 8, some southern Prince George's County, and then some other areas in DC have been coming. And we don't like to say no. If people want to get their vaccine here, we want to get it in as many arms as possible. So we have been giving the vaccine to those cohort of people, and soon we'll be opening to our staff and their family members. So appointed family members, not, you can't bring your whole family, but you can choose somebody within your family that you would like to get vaccinated, and we'll be starting that next week. We hope to soon to be able to open up more broadly. Again, we're following the mandates of the district to make sure that we get them to the people that need it the most first, and then spread it from there. But certainly, for us to get out of this pandemic, we're going to have to give it to as many people as possible. So as quick as we can get to everybody being able to get this vaccine, the quicker we can do that, the better. And certainly when we do that, we'll still be here. We'll still be, have our clinic running just, every day except for holidays, and we don't run it on weekends. But we are, we're primed and we're set to have a clinic that runs fantastic in this community here in Ward 7 and 8 that can serve the whole community.
And can they just show up, or do they have to call and make an appointment? How does that work?
It's all by appointment. It's all by appointment. And at the time that we're ready to open up the community, of course, everybody will know. We'll have a number. We'll have a line that people can call to set up their appointment. And that's the best way to do it, because just having everybody line up is a little bit too chaotic. It has to be done very carefully, because at the time that we give them the first dose, we have to make their appointment for the second dose. So just all the things in the logistics of giving the vaccine. The vaccine has to be handled and managed. The refrigeration is somewhat complex. So because of all those things, we have to make sure that it is controlled, and it is done by appointment.
Dr. Strudwick, thank you so much. We're glad you're over there at UMC. And I shouldn't say over there, because you're just right up the street from us. Right. So, but glad to have you. How long have you been at the hospital?
I have been at the hospital for exactly 2 months. But I'll tell you, I've practiced medicine in Washington, D.C. for 30 years. And I'm familiar with United Medical Center when I was a kid. My father was a general surgeon. This was one of his main hospitals. It was called Caprid's at the time. And so I used to come and the hallways of United Medical Center was my playground to a certain extent. So I've just been here for 2 months, but I've been practicing in Washington, D.C. and well aware of the disparities and the issues and the positive things and the negative things and everything in Washington, D.C. overall for my entire career. And I'm very happy to be here. This is definitely where I should be. When I came here, I found the people here. There are so many people that are hardworking, so smart, so mission oriented. It's a family environment. The staff of the hospital reflects the community, and so the staff of the hospital wants to serve the community. It's about service. And great things are happening here, and I'm just proud to be here.
Well, you know, I've heard so much of what you're saying before, and I'm glad that you have publicly actually attested to the fact of what you've been seeing there. We're really glad that you're there, and our platform is open to you anytime. If you have information you want to share with the community, we certainly look forward to having you back.
Absolutely. My
All
pleasure.
right. All right. Stay safe. Thank you.